Hi, this is Travis Pearson for MM669 Unit 2 Journal. I'm supposed to discuss a patient interaction where there was transference or countertransference, prejudice, or bias. With some of the kids that I have had previously, since I haven't had my first clinical yet, I have had biased from me, I think, towards the parents, maybe on parenting decisions and how they raise their parents, and I guess that's just because I grew up in a rural environment with probably more authoritarian parents than they have now. I just see the parents on the cell phones, the kids on the cell phones, and you're in a meeting trying to educate these people, and it just feels like it's a difficult situation because they won't take enough time off their electronic device, to even engage in a therapeutic session that they're paying money to come in for. So I have some prejudice towards parents and children in these type of situations, and I know that. So that's another reason I have to really like rein in my thought process and what's going on. And I don't know everything that's going on in their life, and I have to remember that when I get these biases and prejudices. As far They're more bias than prejudice. I'm really not. I mean, maybe we're all a little prejudiced some way, but I don't feel like I'm prejudiced towards anybody for any particular reason. I do know that as a nurse, sometimes it can get, as a psychiatric nurse, it can be difficult to take care of homeless patients day in and day out, just because it's like the same thing. You go in there, you get them all fixed up, you get them doing good, and then you turn them back out, and then they do the exact same thing, and then come in a couple months later, and you're just like, holy cow, what are we doing? We got to break this cycle. So those things, those cause me some bias, I know, in my decision making. So I need to understand these things. As far as a specific patient interaction, there's not one I can relate to right offhand, but I just know that these are things that stick out to me in my nursing and psychiatric nurse practitioner careers that I need to be aware of, so I understand what my thoughts are towards these individuals so I can provide them the best quality care. And if I can't, if I'm just like frustrated, I need to pass those patients to somebody else that can do a better job. So at the end of the day, you gotta do like an internal check and just make sure that you're gonna be okay taking care of this particular patient population, and know that there's going to be a couple that are going to cause you a little bit, but make sure that you know that the care you're giving is the same that you would give to anybody else. So all right, this is Travis Pearson. Thanks. Bye.